I think there are several unique attributes that are really quite different than any other programs that are in the San Diego area. Number one, we're the only program that offers intensive treatment for OCD and anxiety disorders. Number two, we have both the adult programs as well as the child and adolescent programs on site, and there really are not that many intensive treatment programs for kids. We also offer and actually require for the parents of the children and the adolescents very strong family involvement, and we have a parent education program called Parent University that we actually require the parents, or at least one parent, to attend. Even for the adult programs, especially for young adults who may be living with their parents or have close relationship with their parents who are involved in helping them with their care, we often will get their parents involved in Parent University and family sessions as well. In addition, it's one of the few programs around where the patients get a large amount of time devoted to individual therapy in addition to the group work. There's several other intensive programs around the area that really just have group and have very little in the way of individual therapy. But individual therapy is incredibly important for treatment of very specific disorders and very specific combinations of disorders, including OCD, panic disorder, major depression, and so on. And without that, if you try to have a one-size-fits-all sort of treatment program, it really won't work very well. So in our programs, we offer several hours a day of the individual work, as well as at least 1 to 2 hours a day of the group work. The program offers state-of-the-art treatment, the gold standards of treatment, as proven by over 40 years of clinical trials. And yet, very few clinicians out in the community have the training or the clinical experience or the knowledge to be able to provide those treatments. Here we focus on those. So we're offering something that isn't even available necessarily in an outpatient level. Even when you compare to other psychiatric hospitals, to other psychiatric outpatient clinics or other psychiatric intensive programs, we're still unique because none of those places have specialists in these areas. So Rogers, each of its major programs are run and directed by people who have years and years of subspecialty experience with OCD. The eating disorders programs, for example, at the residential treatment center, they're run by eating disorders experts. The anxiety disorders programs are run by anxiety disorders experts. You don't get that at most other places. So there is the difference between general psychiatric and mental health care versus subspecialty, highly focused psychiatric and mental health care. So what we specialize in is getting people who have been very ill for very long periods of time, who haven't done well with standard treatments, and restoring their normal functioning and improving their symptoms dramatically.